In this segment, we will review various treatment modalities. We will mostly focus on the behavioral treatment options, as pharmacologic treatment is unfortunately largely inaccessible in humanitarian settings. However, it will be briefly reviewed at the end. Behavioral counseling consists of individual therapy with cognitive behavioral therapy the most utilized, intensive outpatient programs, and inpatient treatment, which again may be scarce or not even available. There is also group therapy and mutual aid groups such as 12-step, which we will review. To review motivational interviewing, the 4 tenets include a patient-centered approach, enhancing intrinsic motivation to change, developing that discrepancy and resolving ambivalence, and providing brief motivational counseling, also known as SBIRT, screening, brief intervention, and referral to treatment. Keep in mind that SBIRT was developed for at-risk alcohol use and is an evidence-based approach. However, it may be useful in addressing other substances of concern. Here is a reminder of our motivational interviewing ORS approach. Cognitive behavioral therapy is based on the social learning theory. The goal is to modify biased cognitions and attributions, alter behaviors that increase vulnerability to substance use, better understand risk factors, develop more accurate attributions and cognitions, increase self-efficacy, and develop effective coping responses. Steps of cognitive behavioral therapy include recognition of cognitions and behaviors and expanding effective coping responses, i.e., motivation and assertiveness. At times, homework is even given focusing on self-monitoring of substance use and rehearsing coping responses. Components of CBT, cognitive behavior therapy, include psychoeducation, functional analysis, developing coping skills, enhancing problem-solving skills and interpersonal functioning, and increasing recovery-focused activities. An example of CBT-based therapy is the community reinforcement approach, or CRA. The aim of CRA is to make abstinence more rewarding. It consists of counseling, the creation of new activities to participate in, employment assistance, accessing social services, and even couples counseling. Another CBT-based therapy is combined behavioral intervention, or CBI. CBI is a combination of CBT and MI, or motivational interviewing, and 12-step facilitation interventions. It is designed more so for those with a lower motivation to change. It offers mutual help programs and participation of significant others if applicable. Another CBT-based therapy is mindfulness-based relapse prevention. This consists of teaching mindfulness meditation and increased awareness of thoughts, feelings, and environment, with the goal of managing cravings and negative emotional states. Another CBT-based therapy is mindfulness-based relapse prevention. This consists of teaching mindfulness meditation and increased acceptance and commitment therapy emphasizes the acceptance of aversive internal experiences, increasing cognitive flexibility, reducing experiential avoidance, and relying on mindfulness. Shifting gears, 12-step and mutual helping is another approach that is taken in behavioral treatment modalities of substance use disorders. In general, they are abstinence-based and consist of a 12-step facilitation, with the classic example being Alcoholics Anonymous, which is present worldwide. It aims to address engagement and often provides sponsorship. Enhanced referral refers to 12-step plus individual sessions. This includes contracting for a plan, attendance monitoring, obtaining a sponsor, and linking with a peer. Lastly, network support consists of adaptation of 12-step. However, it provides support from a broader social network. Other adjunctive modalities include couples and family therapies, social services, and contingency management, which provide incentives to encourage treatment adherence and/or abstinence. Other adjunctive modalities include couples and family therapies, social services, and contingency management. Lastly, reviewing pharmacologic treatment options for 3 commonly used substances include opioids, alcohol, and nicotine. Keep in mind these medications are approved for use in the United States, and approval is contingent on federal and local law. For opioid use disorder, we have the option of using methadone, which is a full opioid agonist, buprenorphine, which is a partial opioid agonist, and naltrexone, which is an opioid antagonist. Though not a treatment option, it's important to remember the role of naloxone, which is an opioid antagonist, and can be useful in the reversal of opioid-induced overdoses. For alcohol, we use naltrexone, which is also an opioid antagonist, disulfiram, which inhibits the enzymatic breakdown of alcohol, and acamprosate, which decreases craving via acting on chloride ion channels. For nicotine, which is the most widely used substance worldwide, nicotine replacement therapy in the form of a patch, gum, or lozenge is often utilized. Varenicline, which blocks nicotine receptors with the goal of decreasing craving in the context of setting a quit date within 4 to 12 weeks. And lastly, bupropion, which is a serotonergic norepinephrine reuptake inhibitor, is also used in the treatment of depression and anxiety. Again, keep in mind that these medications are utilized in the United States and other countries, depending on federal law. Unfortunately, they remain largely unavailable worldwide, and resources such as this can hopefully shed light on their essential life-saving needs. That concludes the segment on substance use disorders in humanitarian settings. We encourage you to utilize the tools provided, advocate, address stigma, and start creating change one step at a time.